Thanks everyone for joining us for today's webinar. Another wonderful update about the COVID vaccines and vaccinations. Great to have you online with us. We've got Jodi Haartsen and Associate Professor Anneke van der Walt waiting in the wings. And in the spirit of reconciliation, MS Limited acknowledges the traditional custodians of country throughout Australia, and we acknowledge the connections to land, sea and community. We pay our respects to elders past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islander people today. It is my pleasure to introduce you to Jodi and to Anneke. Anneke needs to just pop her camera on, but that's okay, that will come. Jodi Haartsen is our Executive Manager here at MS. She's the Executive Manager of the Client Engagement and Wellbeing team. Jodi started MS Healthcare and Nursing over 20 years ago as part of a nursing career in general neurology, neurosurgery, nursing education and research. Jodi's roles include MS Nurse Practitioner and Manager of the MS Clinic at Eastern Health, MS Researcher and MS Educator. She's a member of the Global MS Brain Health Steering Committee, and she is passionate about the MS Brain Health Initiative. She's also studied a Master of Nursing and Naturopathy. Associate Professor Anneke van der Walt is a neurologist at Alfred Health in Melbourne, where she's appointed as the head of MS and Neuro-Ophthalmology. She leads the MS and Neuro-Ophthalmology Research Group at the Central Clinical School of Monash Uni. Anneke completed her undergraduate training in South Africa before relocating to Australia, where she completed specialist training in neurology and a PhD in neuroscience at the University of Melbourne. So it's fabulous to have both Anneke and Jodi with us this morning, leading our discussion. I might even turn off my camera because that way you two will be able to fill people's screens, and I'll leave it to you. Thank you both.
Thanks, Andrea. And thanks, Anneke. Back for session number 3 on what is a very important topic for people living with MS at the moment, and that is the vaccinations. And so I'm sure, like us at MSL, you at the MS Clinic there are asked questions about vaccinations all day, every day. And so thank you so much again, Anneke, for giving your time to come and help us answer some of these important questions.
No problem. Thanks for having me back.
There you are. Great. Yes, thanks so much. You were just frozen for a minute there. So I guess I'll start off with a question that we sort of have discussed in our first and second video, but it's still sort of coming up, and we know new information is coming up all the time. So are vaccinations safe for people with MS, and will they make people with their MS worse? Is there any new information about that?
Hi, Jodi. Yeah, look, I think that question still comes up quite a bit, and I think the good news is that there really hasn't been much change in the overall message, and that's always a good thing. You know, we now have, you know, millions and millions, I think, you know, close to 100 million people that's received some of these vaccines in the world, and there's not really been any new side effects. There's also people who's received the vaccine, particularly in the UK and the US, close to a year ago now. And again, we're not seeing any side effects coming up down the track. So for people with MS, the message is still the same in that there's no additional side effects to anybody else that someone with MS should really be anticipating. And that we know that these vaccines are not live vaccines and are not going to interfere with treatments and how people generally feel after perhaps a couple of days. You know, some people do get some mild side effects, but overall the vaccines do appear to be really safe, and also for people with MS.
Great, that's good to know. And we're hearing a lot about the Delta strain and different strains now, and a couple of people have been asking us the question, well, should we still have the vaccine now? You know, other countries ahead, should we wait? Should we, what's your response to that?
Look, I think that's a really good question, and I think that's something that you know, we'll see some more information emerging about in the next few months probably. I guess the main thing is to know that the current vaccines that we have does offer protection against all the different strains of the virus at the moment. And although it's perhaps slightly less to the Delta variant, it still provides people with, you know, a very robust response to the Delta variant. And the most important thing to remember is that if people are vaccinated, and even if they do then get the Delta variant, this is still the best way to keep yourself out of hospital. So it does prevent a serious infection, keeping people, you know, from having to go into hospital, getting very sick from it, or even dying. So the vaccines give us really good protection to the variant. Something that I think we'll probably have to see in the next few months is what happens in terms of advice around boosters. And it's highly likely that everybody will be offered a booster at some point. And in some countries, this is already happening. So in some countries in Europe, in the US, and the UK, there's sort of a really big discussion around when people should have a booster and what that booster will look like. So, but the very big initial step is to get that vaccine and to get that done so that you can give yourself that initial protection.
Just back on the boosters, because we sort of brought it up there, but will people with MS, do you think, more likely need a booster, or will that be something that's sort of, you know, part of if there is a need for boosters, will it be general population?
Well, I think in the end, probably everybody will need a booster, but it's likely that, you know, people with MS or people with medical problems, you know, the elderly will probably qualify to get those boosters perhaps a bit earlier. So we'll again probably see a stage rollout. With the same as we have with the current vaccination program, that people at higher risk will be eligible to get boosters earlier. So I think, you know, that's certainly what we've seen perhaps in the UK, where they're now planning for that booster vaccination program. And again, people with MS falls into that early category of increased risk, so they will be getting boosters earlier. We don't quite know what happens to people's immunity to the vaccine over time. It does look like your immunity to the vaccine wanes over time. So after 6 months, 12 months after vaccination, your protection from the vaccine does drop off. Although it appears to be still staying around about 50% in the general population. But generally, we would like to boost that up. So that's why people would get a booster. And the booster will probably then also, you know, contribute in the way that it would have more variations of the virus in there. So better protection against some of the newest strains. So very similar, I suppose, that we have for flu vaccines generally, but people need that vaccine every year.
And is there a way that you were talking about how people have that and, you know, have a mount a certain response to it? Is there a way of measuring that? And is there a way that people with MS can have that done more as a priority, or done, you know, outside of the usual practices?
Yes, there's certainly are ways to measure that. So, you know, the general test that we rely on is to test people's antibody levels. And we would generally look at what people's response is about a month after the second dose of a vaccine, to see how robust the immune system has responded to the vaccine. And then repeating that again over time can tell us, you know, how does that change over time. At the moment, it's not really routinely available to get those tests done. So it's really, you know, done in certain tests and trial situations. So I think we have mentioned before that there are many academic centres, MS centres in Australia that's participating in a trial where we are actually looking in the Australian people with MS to see how well or people respond to vaccinations if they're on different disease modifying treatments. I guess I should add though that antibodies only tell us a part of the story. It gives us a part of the picture, because there are different ways that the immune system is responding to vaccines. So measuring that antibody level is, that's generally done because it's an easy way to measure what the immune system is doing. But there are other cells that are also involved in protecting people and giving you a response to a vaccine. And these are generally, T cells and other B cells as well, that is stimulated by a vaccine, and they're not as easily measured. So the antibodies give us a picture of what's happening, but not the full picture.
Okay, so I'm hearing that there's lots of different tags to say, cell tags that say, hey, this immunisation is working, and we're just measuring one at the moment, but we'll understand more when we have a chance to measure lots of them, in particularly in research, which will be really important research to have. So some of these vaccinations, other questions that we've been having a little bit more around the vaccination safety in terms of Pfizer and Moderna, and the other ones being a little bit newer, and how do we know that they're safe?
Well, I think we can, there's a lot of ongoing data being collected around safety. So, this, like I said before, we have millions of people in the world that's now received the vaccinations, and each country has a very, very strict safety surveillance program where any side effect is reported and documented, and then reported back to the authorities that look after these vaccinations to make sure that nothing unforeseen is occurring. So we know that, there's not really been any additional safety events. So the main thing that people still experience is perhaps a headache and so a mild reaction to the vaccine. Some people feel a bit tired, and if you're a person living with MS, that can also be a little bit worse for you perhaps. And also, for some people living with MS, that can actually trigger some of their usual MS symptoms and make it worse for a few days as well. So it's good to think about those and anticipate it. But in terms of some of the more serious side effects that people may have been hearing about, particularly all the clotting disorders that's been in the news with the AstraZeneca vaccine, the occurrence of these have remained generally steady, with about 10 in a million people experiencing these side effects. So it roughly translates to about 1 in 350,000 people will experience one of these side effects. But we are getting better at recognizing them and treating it, which is really good. So the outcomes are much better than it was initially reported to be, because of just general awareness of these side effects.
Yeah. Yeah. Now, I know you have a really big clinic in Melbourne with over 1,000 people coming to your clinic. So how's it going? Like, what sort of stories are you hearing from people having the vaccinations in Melbourne, and how's it going just at the coalface?
Mm-hmm. Well, it's actually going, really well. We're still getting a lot of questions from people, especially in their specific circumstances. But from, the people who's gone through it and they've had their vaccines, and this, there's a lot of people who's had the AstraZeneca vaccine, there's a lot of people who's had the Pfizer vaccine, and, we really haven't seen, anything, strange. We just haven't seen any unusual side effects, anything that we didn't think would happen. So I think, overall, the message has been really positive. I think, people living with MS is often, living with a lot of different risks in their lives. They've already had to think about risks associated with their medications and the drugs that they have to go on, disease-modifying treatments, and balancing and thinking about, what does this particular drug mean for me in my situation. So I think in many cases, for many people living with MS, thinking about the risks associated with vaccines is not, a new thought process. It's something that they've been through. And it speaks to the resilience and the robustness of people living with MS, that, they just sort of, take this in their stride. For most people, they have a think about it, they have a good discussion around it, and then move on, because they've been through these discussions so many times in their lives already.
And understand, so true, and understand the concept of risk versus benefit. For people who are, and you probably have this in clinic as well too, there are people who are calling us at MSL who are feeling particularly anxious about it, and feeling pretty scared about that, because I guess there's lots of media hype about it, and it's so right there for you. So do you have any tips to help those people who are feeling particularly anxious or feeling particularly worried about it?
I think it is tricky. Everybody's different, and everybody's, you know, the way that we think about risk is a very personal thing. So I think in the first place, it's, you know, it's good to sort of, you know, acknowledge that you're feeling worried about it, and then sort of, you know, even jotting down exactly what it is that worries you. That's not always easy, because sometimes it's just a general feeling of worry that it, rather than a specific, you know, oh, I'm going to get this side effect. But trying to break it down for yourselves in little chunks is often quite helpful, you know, just to sort of make a very big problem a little bit more manageable. And then actually, you know, making time to talk to your neurologist or your GP about, you know, specific questions that you might have. Something that is often really helpful is actually, you know, looking at, you know, groups of people with that's similar to yourself, living with MS, that's gone through this, and making contact with people through MSL, for instance, where, you know, people have been vaccinated, to see what their personal experience was with the vaccine, can be really reassuring to people, to see actually, you know, this person was fine, and this thing that I was worried about, you know, didn't happen to them. So hopefully, you know, by doing that and looking around you for support, you generally, you know, it often can be quite helpful. And not giving up, you know. So if you are really worried, you might need several of these sessions to talk it through. And, you know, I think, you know, we're all there to do that, because we do feel this is an incredibly important health initiative, and that we would like to see all people living with MS get vaccinated so that they can be protected in the long run.
That's they're great tips, thank you. Especially that part about breaking it down and writing down. It is hard when you feel worried about something to actually break it down. So thanks, that's a really good tip for people to work out what it is that they're feeling really anxious about. So thank you. We've had some calls as well about people in special groups who may not be, who are a bit concerned, particularly from women who are pregnant. Are there any groups of people that are not or should avoid having the vaccination, so for instance, pregnant with MS or on a certain treatment?
Well, that's sort of, you know, one of the changes in recommendations has been that women that are pregnant can now be vaccinated. If you are pregnant, and living with MS as well, then you are eligible to get vaccinated with the Pfizer vaccine or the Moderna vaccine that's just become available in Australia as well. And that information is based on about 90,000 pregnancies that have now been reported in the US, in pregnant, you know, with pregnant women being vaccinated in the US without any adverse outcomes, so no increased risk in side effects or adverse outcome to the pregnancy or to the baby, which is a really, you know, reassuring group, like large group of pregnancies, so that we can know that there's no unforeseen, very rare problems that's happening. So when we know that pregnant women are at an increased risk of very severe COVID if they do contract COVID, and I think it's therefore really important for pregnant women living with MS to get vaccinated if they haven't been. Yeah, so I think the only people I think where, you know, you should probably think about when you get vaccinated rather than not getting vaccinated. And this would probably be someone who's just had a relapse, for instance, who's just had very high doses of steroids. It's probably a good idea to just wait a couple of weeks before you get vaccinated. So we wouldn't want people to get vaccinated in the middle of a relapse, just because it can make some of those symptoms a little bit worse. And often in the context of very high doses of steroids, the vaccines might not work as well. So good to wait in that context. And then also, you know, someone who's, you know, the same as for anybody else. If you've ever had a severe allergic reaction to a vaccine, it would be very important to get very expert health advice before you get vaccinated. So that can be done in a very, you know, observed way and a safe way. But those are probably the only, the groups that I can think about. We also, of course, have seen a change in policy around children. So everybody older than 12 will now be eligible soon. So that's also something new. And that means that children living with MS will also now be eligible for vaccination.
That's sort of been some questions coming in as well too about fears and concerns about the long-term effects of vaccinations in children, and should, even mums who have had vaccinations are worried for their children for the long-term effects. So what do you how would you reassure people about having children vaccinated?
Well, I think, again, it's that balance between benefit versus risk. And I think that the benefit risks discussion around COVID in children has certainly changed, particularly in the context with the new strains, the Delta variant in particular, where we're seeing that it is affecting children much more than with the previous variants, where we almost saw no infections in children. And some of these children do get extremely unwell. So the risk is certainly very big if, than it was for a child to get quite unwell with COVID. We know that the immediate side effects of the vaccinations is no different in children. So the risk from that point of view is extremely low. In terms of long-term side effects, and people often have these concerns around vaccinations, but we have to remember that the effect of the vaccine is generally the drug itself, the molecule itself, is out of your system very quickly. And that response in your immune system, again, it is supposed to trigger a long-term memory change in your immune system. But we see that from the studies that's been published that diminishes over time as well. To this point, there really hasn't been any, long-term side effects that's been reported. But there has been lots of long-term side effects in terms of COVID infection, people experiencing long COVID and very prolonged and disabling symptoms after the infection. So to me, the benefits still far outweigh any potential risk, even though there's still a lot of, there are some unknowns, and it will take some time for people to be fully reassured, I think.
I guess from my understanding, lots of the vaccinations most vaccinations don't have long-term effects because of the way that they work, and so that's why vaccinations can be approved quicker and stuff, because the way that they work, that they don't hang around in the body very long. That gives us some degree of reassurance about the safety, because vaccinations work in a particular way that very rarely cause long-term effects. Is that correct?
No, that's absolutely correct. And even in, true severe vaccine reactions that we see, where people are, that people do have vaccine-related damage to their bodies, it's usually related to that very initial reaction, So it's not to do with a late reaction months and weeks down the track. It really is about what happens to you in that initial stage, and that's usually around the first dose of the vaccine. So I really don't think that there will be any long-term side effects from these vaccines. Like you say, Jodi, it's not something that we've seen with any other vaccine.
Yeah, just in the way that they work. So one of the questions that keeps coming up as well is the certain treatments. I guess there's lots of confusing information for people around the different treatments in MS, and some which mount, what are called B cell responses. That seems to be a new word in everybody's language with MS now, is B cell responses. So what's your general advice about, and where can people go for good information about which treatment is okay and which timing should, what's the timing? For instance, in Tysabri, do they need to not have the vaccination? Or so what's your general advice around that?
Well, I think the first point again is that the vaccines are all safe regardless of which disease-modifying treatment you're on. The second thing to say is that, yes, it does appear that some people on some medications will perhaps have less of a response to the vaccines, especially if we're only measuring the antibody responses. So the cell tagger that you mentioned before, where we're only measuring one of these, And we know this from some small studies that's emerged. There's a small study that came out of Israel in particular, where about 125 people, I think, with MS was studied, and they had a look at how they responded to the vaccine compared to people without MS. And in this group, there were people on ocrelizumab or Ocrevus, fingolimod, and Mavenclad or cladribine. And in particular, people with ocrelizumab and fingolimod or Gilenya had much less of a response to the vaccine. But again, this was only measuring this one tag, one sort of compartment of the response without looking at the rest of the immune system. So I think in general, we would advise people on any disease-modifying treatment to get the vaccine. We would look at if you've just been diagnosed with MS and you're starting on a treatment, it might be worthwhile to have a good discussion to see if you should be vaccinated first, just to get that out of the way before you start on a treatment, to make sure you get the best possible response from the vaccine. And we do this not just with the COVID vaccine, but we would often do this as well with people who say have no immunity against chickenpox or something like that. We would vaccinate them first before starting them on their treatment. If you're already on treatment, particularly if you're on ocrelizumab, it might be a good thing just to think about, when you have your vaccination in terms of, in relation to your infusion. And here I think is sometimes where people get confused, because there's not really any hard scientific evidence to say, oh, you've got to wait so long or this long, to do this. So every health center seems to have a little bit of their own way to do this. The longer you can wait after your ocrelizumab infusion, the better, but that's not always practical, and we have to also consider the risks of the MS kicking back in if you delay your drugs or your infusions too long. People on fingolimod or Gilenya, there has been some concern around this as well, but again, there's no reason to stop your Gilenya to get a vaccine. It can actually be really dangerous to stop it, because of the withdrawal of the drug can make the MS kick in quite a bit. So again, it's better to get that vaccine on board, because we're certainly not seeing people around the world on Gilenya ending up in hospital when they get COVID. So, I think that is a reflection of the fact that we're not measuring the full measure of the immune system, and how it's responding to vaccines. So those are probably, the most commonest questions we're seeing when people are in the drugs that people are worried about.
Yeah, we're certainly seeing that too. I think it's really important to have that message of the risk of stopping your medication for an extended period of time in MS is much higher than the risk of the vaccination, maybe or maybe not. Getting that full response. So what I'm hearing is that even if you have the vaccination, you might not get a full response, but it's still better than having it at all. And it's still not worth going off your medication. But if there's room to move in terms of stopping it, what about Tysabri or natalizumab?
Well, with Tysabri, we certainly have this, that people on Tysabri seems to have a really robust response to vaccines. So again, there's no reason to change your infusion schedule or do anything differently. You would just go ahead and have that vaccination.
Yeah, which is good to know as well too, that there's no timing changes that need to happen.
I think the only things where you could perhaps shuffle things around a bit is, if you're first starting on a drug or with ocrelizumab or, the 6 monthly infusions.
Yeah, yep. Thanks. And will they, in terms of those medications are the ones that particularly Ocrevus and Mavenclad, they're the ones, well, we didn't actually talk about Mavenclad, so I might go back a little bit and just ask about the timing in relation to Mavenclad or cladribine, because that's certainly a question that we're getting a lot as well too, in terms of when is it okay for people should people stop having their second year dose, for instance?
Well, I think again, everybody's situation is a little bit different. So there could be room to delay that second dose to get your vaccination in first, especially if your MS has been quite stable. If you do go ahead and have the second cycle, it's probably a good idea to then wait a little bit afterwards before you have your vaccinations. So that could be, generally that would be about 3 months, but anywhere from about a month after the dosing, you could look at having your vaccinations.
Yeah, and is there any blood tests that will tell you that it's the right time or wrong time to do that?
Well, not really. I mean, you could have a look at someone's lymphocyte count, to see where they're at. But again, we're measuring only one compartment of the immune system. So the main reason we do that is really to check in terms of safety, if someone is severely immunosuppressed or if their lymphocytes are suppressed enough, which is one of the immune cells that we measure, to see, if someone is at risk of a viral infection. But yeah, I think, I wouldn't really use that as a guide as to when I would vaccinate, someone who's just had Mavenclad.
It seems like we don't really have enough information to use that one single test of that one little tag when there's so many multiple tags that we should be looking at. And I certainly learned as an MS nurse that yesterday's blood test can still be quite different from tomorrow's blood test in terms of looking at those lymphocytes as well too. So those sorts of things make it a really difficult to actually use that as your only evidence to be able to suggest timing.
Yeah,
so.
Absolutely,
And a lot of people who we've had a few calls from people who are newly diagnosed wondering about that question again, about whether they should stop, whether they should delay that starting a treatment as well too. So how are you managing that in clinic now?
Look, I think at the moment we generally, if there's any wiggle room that someone is reasonably well controlled and not having, ongoing recurrent relapses, shortly after each other, we would generally, allow people and encourage people to get that COVID vaccine done first before they start on their disease-modifying treatment. But then it also does depend a bit on, which treatment they're going to go on. So, if it's something that is, something like, for instance, natalizumab or Tecfidera or any of those type of medications, we would generally, expect that their vaccination response is going to be normal. So we would, just get going with the MS treatment and the vaccinations at the same time. But if someone is moving towards ocrelizumab or, cladribine or Mavenclad or even perhaps fingolimod, we would probably try and get them vaccinated before they start on that treatment.
Yep. And do you think long term, so I guess it's probably each individual person it's an individual case by case thing when you weigh up how important it is to start treatment and all those sorts of considerations to be there. So I guess that's just about keeping on talking to your neurologist really, and keeping up that dialogue and keeping it as best you can. Not always easy in the current times for people to be able to access that information as well too, and that can be certainly something that that I know we encourage people to ring us if they're having trouble at MSL, because we can help direct calls sometimes and help prioritise and triage so that information gets through. So another question that came will we need COVID injections every year like the flu in the future, do you think?
Look, I think it's really seems quite likely that we will. I think a lot of parts of the world are moving towards a booster, where people will get a booster. I think in Germany, people are now getting boosters routinely at 6 months after their vaccinations, and we'll likely see that happening in Australia as well once most of the population has had that first cycle of vaccinations. And then I guess we would have to see what happens after that, but it seems unlikely that, in the years to come, we'll probably get frequent boosters, I suspect.
And for people who've had the vaccination, particularly those living in Melbourne and New South Wales, Victoria and New South Wales at the moment, do you think people living with MS should be, even if they've had the vaccination, more cautious? Should their families be more cautious in terms of going out, or what's your sort of recommendation for that now?
Well, I think probably the first thing is to say that, for someone living with MS, it's really important for the people around them to get vaccinated as well. So to get the people living in your household, if they're eligible, to get them vaccinated. and to see, where else your close contacts are, whether it's at work and what the situation is there. Other than that, I think it's really important to comply with the health advice that's been given in your local area, because those, even though, to us looking from the outside, it all seems extremely frustrating and, all of that, these policies have been put in place for a reason, so we do need to comply with them. And the reason for that is that even if you're vaccinated, you can still get infected, so it's the same as with many other vaccines. The idea of the vaccine is to prevent a serious infection and to prevent people being hospitalized and dying. So you can still contract that vaccine and you can potentially still spread the virus. So that is why you still have to comply with health regulations, whether it's wearing a mask, or, and keeping that social distancing in place, all of those things people with MS still have to, comply with and be careful with. So there's no other, there's not really a change in rules around that.
So do you think people who have been on Gilenya and Ocrevus or ocrelizumab and fingolimod, should they, or cladribine, should they be more cautious? Is there any evidence to suggest that, they're more likely to get, is it COVID? Is it too early to tell?
Look, it's probably, we've seen several large studies being published already, where, where that included like up to 1,500 patients from different countries on different disease-modifying treatments with them living with MS on different DMTs. That's all been published now, and for most of the DMTs, it appears that people's outcomes are the same. So whether they have, whether they're on fingolimod or cladribine, there's really no difference in the outcome. So what I mean by that is, what is the likelihood of getting severe COVID, so you land in hospital and in ICU and dying? That seems similar to the general population. The only slight difference we've seen is in people who've been on ocrelizumab, and where there has been an increased reports of hospitalizations in some of the studies, but not an increased risk of death. So that's always, that's an interesting difference. So I guess in that context, and the fact that we know that there's just a lot of unknowns in terms of how well the other parts of the immune system is protecting us after vaccination, it is a good idea and sensible for people on ocrelizumab, and people who's been on fingolimod perhaps to be extra careful and know what the regulations are, and maintain that social distancing, maintain your mask wearing, and your hand hygiene, all of those sorts of things, and just perhaps be a little bit aware and not throw all caution to the wind.
I know some people are sort of, from what we're hearing, that are sort of staying at home and missing and skipping a lot of their regular health checks. And as time goes on, Victoria's been 200 days. Are you seeing that in clinic? And what's your thoughts around those sorts of keeping up with routine brain health checks and even health checks?
I think, look, I think that is something that has been quite a worrying thing to observe, is that, particularly a breakdown around people's regular therapies, their physiotherapy, that exercise, for many people with MS, lockdown has been a blessing because of the ability to work from home, and we hope to see that flexibility and work hours continue. But it also has pulled people out of their usual, rehabilitation and brain health routines, like you say, Jodi. So that is a bit of a worry. I think in the first instance, it's really important that you should have a face-to-face visit with your neurologist at least once a year. So if you haven't had that for a while, it is good to think about when your next appointment is coming up. And we are sort of bound by what our hospital system is telling us about who we can see in person and things like that. But if it is possible and it seems doable, having that once a year face-to-face consultation would be an absolute minimum requirement, I think. The other thing is to make sure that you do keep up to date and get your MRI scans, get your blood tests if you need them, because we can't just indefinitely postpone these things. The risks of that it starts outweighing any benefit from, you know, sheltering at home and not going and doing that. And over time, hospitals and health systems has put in lots of measures to keep people safe if they do come in for those sorts of things as well. And I've not seen a single person who's been infected from coming in for an MRI scan and getting that done. But I have seen the opposite. I have seen people skip those tests, and I've seen bad outcomes from that. So I think it's really important for people to try and keep up to date with that. I also think it's really worthwhile having a discussion around what is essential to you to keep you going at home. You know, if you do need physiotherapy, if you do need occupational therapy, there are ways to access those services even in lockdown circumstances. And you know, it's good to have a think about, you know, what are you losing by not, you know, keeping that up. Because these things can be very hard to catch up on, you know, so losing a bit of function here and there is not something that, for some people living with MS, it has a long-term impact. And, you know, I would really like to see us try and avoid and minimize that as much as possible.
That's true, and perhaps even though we're all getting a bit sick of virtual, I am, and but still something is the idea that something is better than nothing in this case, and that even virtual physio is still better than no physio at all, and so I think that sort of yeah, that's a really important message around that loss of function, and that concept of doing all that, getting those routine tests. I, like you, have not seen a MRI place or a blood test place ever been an exposure site, so that's good. I think they do really keep very, very, very strict protocols about keeping people safe and making sure they do that. And so therefore, again, the benefits of keeping up that regular routine brain health checks, like an MRI and the blood tests as well too, are really, really important. And even people going in to have treatment in the treatment centres, they also, I know, are very, very strict on making sure they keep all the right protocols and people
they're
safe.
very, yeah.
And just a couple of people have asked the question about whether the vaccine will affect their JCV antibody test for people on Tysabri. And is there any evidence of that? Do we know? What's been your experience to date in clinic? Any?
No, there should not be any interaction if you think about it from a biological point of view, and we certainly haven't seen that either.
Yeah, no, good. So reassurance there. There's absolutely no reason why it would affect it. Like every other vaccine that we've had, the flu vaccination doesn't affect it either as well.
No.
Either as well too. Okay. One of the things that people ask a lot about as well too, because I mean, we'd love to have you every week to talk to us about up-to-date information, but that's not reasonable. So there's a lot of misinformation, and so. And people are hearing different stories all the time, and if you're already frightened, hearing that, you know, hearing stories that sort of that give you incorrect information, what's your advice on where to go for good information, and how do you tell if it's really rubbish information?
Look, I think, you know, it's good just to have the good information is, you know, often on, you know, MS Australia has good information, and it also has a, you know, an update on what the Australian neurologists who look after people with MS, what their, you know, what our consensus is on how people should approach this. But there's really good information on the MS Society of the UK, or MS UK Trust. Their information is really good, and it's constantly being updated as well. And it's a good one to keep an eye on, just because of the UK's, you know, the millions of people that they vaccinated. You know, so there's often where I think we'll see some new things emerging from those groups of people. And also the MS International Federation information is really up to date and very relevant. So those are really good, good sources of information. I think, you know, it's really sometimes hard to sift through the amounts of information that we get bombarded with, you know, and if you, like you say, if you, Jodi, if you're already a little bit worried and you read something on a Facebook group or in a chat group and you go, hang on, you know what, that sounds a bit like me, that could happen to me. Again, you know, just, you know, breaking it down and saying to yourself, what is actually the thing that I'm worried about, and talking it through with someone to help you formulate that. You know, that could be very helpful, because sometimes it's just this general feeling of worry, right? But writing it down and then having a look at some of what do these sort of reliable sources of information tell you about that question, you know, and then also asking, you know, people like MS Limited, asking, you know, your local MS nurse, asking your neurologist, your GP, what they think about the information that you've read. Knowing that sometimes people give you slightly different answers, you know, and writing that down, you know, it helps to just break it down, you know, and frame that question for yourself. You know, and not just reading one thing and then getting so worried that you can't move past it. You know, you have to build yourself a little bit of a bridge to see if you can, you know, get over it.
Sometimes I had a good tip that to ask yourself whether it's your heart responding to the information or your head responding to the information, and to do that little self-check when you read it and say, okay, which is responding first, and therefore should I make sure that I concentrate on my head and not my heart responding to that information as well too, which is kind of interesting. It was a good tip, I think, when you're reading that sort of information as well too. And it does seem now that for MS, the information available on those key places are all very consistent. You know, as you said, UK seems to be quite ahead of because they've done all those vaccinations in the past. So we learn from that, which is great. And it's important to remember when you look at the UK, they've had a different approach to vaccinations than in Australia. So. But yeah, when I do my reading, the MS International Federation, MS Australia, I noticed was only updated. I was updated on the 3rd of August, so it's been consistently updated as well too. And reassuringly, everyone's on the same or very similar page. And I think that another thing that we also are seeing a little bit as well too is that sort of, it might be 2 weeks or it might be 4 weeks. But in terms of timing and stuff, but that's okay. It's okay to have those little differences. It's when the difference is extreme, like stopping your treatment, that's when you have a little bit of a red flag that says, hang on, I know the rule is not to stop my treatment. Timing of weeks might be slightly different to certain people, but that's an okay difference for my neurologist. And so do you think, is that the general way you would approach it as well?
Yeah, definitely. I think it's like there could always be slight differences. So some person might tell you, oh, you know, you should wait, you know, 10 weeks before you get this. Someone might say 6 weeks. Someone might say don't wait at all. And it's important to realize that none of those people are wrong and none of them are 100% right, because we just don't know, you know. And I think it's you know, little differences like that is not, you know, something that should wave a red flag, like you say. You know, it's about when advice is completely different, you know, and where someone would say to you, oh, you know, if you're on X drug, you should not ever get vaccinated ever. You know, that would be odd and not consistent with, you know, the rest of the world's advice, really. I think it's also sometimes, you know, you kind of go through a bit of a wormhole where you focus on one little question that you have and it becomes the focus of everything. And it's sometimes really good to just step back again and go, hang on, you know, the big message is still that the benefits of vaccination outweigh any risk. Getting any vaccination is better than not getting anything. Even if you're not sure how well you're going to respond to that vaccine, you know, it's basically still better than not getting it, because as I've said before, you know, it's not like we're seeing people in Italy and Germany and UK who's been on fingolimod or Ocrevus, you know, in their thousands being admitted to hospital. That's just not happening. You know, people are, you know, people who are vaccinated, you know, are doing just the same as everybody else. So I think, you know, it's important to remember that those big picture things as well, you know, even though there might be something in your specific situation that makes you a bit worried. So it's important to just step back sometimes.
Yeah. And I know, just one final question, I know your team at the Alfred and teams around Australia and teams around the world are doing lots of research on this, and I know that, I also know that you're all reading the research every day. Is the research saying what you thought it would say? I've always found that reassuring as a nurse. Yeah.
It is. Yeah, I also, it is. And that's the thing that I find really reassuring, is that, you know, a year down the track, you know, of rolling out these massive vaccination programs, we haven't seen anything we haven't expected. And I think, and that's been consistent, you know, we're seeing that the immunity to the vaccinations do wear off a bit, but we expected that was going to happen. We expected that people were going to need boosters. You know, we're not seeing any new side effects. You know, everything is remaining just as expected, and that's a very reassuring thing.
Well, thank you. I'm reassured always that I am 100% sure that the Australian neurologists are, you know, well ahead of what's happening globally and completely on track with it all. So, thank you for representing Australian neurologists, and thank you for all the work that you do to make sure that that in Australia we're definitely not the last to know. So it's very reassuring. It's very reassuring. So thank you. Andrea, did you have any?
Yeah, have we got time just for a couple of questions that have come in, a couple of really practical ones that I thought would be worthwhile asking. In preparation for having a vaccine, Panadol, any other recommendations for when people are going to have their vaccine about being ready for it?
Look, I don't think, you know, it's probably better not to take anything beforehand. You know, we have to remember that most people get no side effects, you know, so I don't think there's any reason to pre-medicate or take anything in advance. We do want your immune system to have that response, and so it's probably you know, better to just, you know, leave things as they are and go as you are. I guess, you know, knowing where you're going to go, and, you know, getting an idea, if you haven't been there before, where to go, is a good idea to work that out, because that's always adds a bit of anxiety and stress. And then knowing that you're going to be asked a fair lot of questions. You know, I know when I had my vaccine, I got asked a lot of safety, you know, questions, so be prepared for that. You may also, you know, at the moment, given that vaccinations have been rolled out to many age groups, you may not need a letter anymore from your neurologist. But if you, you know, but if you feel you do, you can always, you know, get a note from your GP or your neurologist to say that you have, you're a person living with MS, that you have this immune drug on board, and that could help you as well. And then, yeah, I think just, you know, going in with all the information and a good attitude, I suppose.
Absolutely.
I went on Saturday and forgot my glasses, so I couldn't read any.
Oh, take your glasses. Take your glasses.
Yeah, take the thing you do for the 15 minutes.
Showed you the question. So that's my tip: bring your glasses.
And I'll combine a couple of questions. Someone was asking about the because there's been a change in the dosage rate, like as in it used to be 12 weeks between doses, and now in New South Wales it can be 6 weeks. Does that have an impact around the whole idea of the booster? And I'm going to combine that with, should we be seeking from our neurologist the antibody test? Like, how much do we need to worry about that?
Yeah, look, there has been a bit of a change around, you know, as you're saying, around, you know, how the interval between the vaccinations, with the AstraZeneca vaccine in particular, where the interval has generally been 12 weeks. So I think, you know, it does appear that people mount a similar immune response if you change the interval between the doses of the vaccine, but it will differ according to which region you are at. So I think, you know, following the advice that's there for your area, you know, and if someone says you can have it a bit sooner, there's no reason not to do that. Unfortunately, asking for a test to get an antibody test, that's not really available. So, so at this point, there's not really a validated, easily available test in Australia that you can just go to a lab and get this test done. So it's, and the reason for that is that there's still a lot of snags when you do those types of tests, because the kits and the assays can be quite different, and you need to know that the test that you're getting is accurate, and that it's been properly implemented, and that sort of process always takes a bit of time. But we might see a change with the, you know, some of the rapid testing coming on board perhaps, but that's not approved yet in Australia formally. So lots of things could still change in the next few months, and it could become easier. I would say, though, if people do get that antibody test, to just remember what we've discussed today in terms of, you know, the different areas of the immune system and what we're actually measuring, and not to get too hung up on that one test.
Absolutely. And I think it's been great that you've reassured us that what we're finding worldwide applies to the people living with MS as it does to the general population, and that's really encouraging as well.
Yeah, no, definitely.
Thank you. There's lots of thank yous coming in, I must say, as well. Really appreciating the detail of the information and the time that you're giving us to answer the questions. Yeah. There are more broad questions, but I think you've pretty much covered what people are asking.
Good.
Okay, well, thank you once again, Anneke. Thank you, Andrea. And for anyone who's got any questions following up, the team will definitely make sure that we will get back to you with any questions and answers. We've got a team of nurses who'll be able to help. And as I said before, you know, speaking to one of the nurses or one of the team on msconnect is certainly an opportunity. We also can help you get in touch with your team if that's what you need as well too. So if you're finding you're having trouble accessing information, if you're finding you're having trouble accessing your team to be able to answer those questions, we know we can't answer everybody's questions, but we can certainly help you find the right information as well too, and we may be able to answer those questions. So it's there's lots of people available to help. But thank you so much for answering a lot of those questions already, Anneke. We really do appreciate it, and also for reassuring us that in your big and busy clinic, so far so good, and you haven't had anything, as you said, that you didn't expect, and that people haven't had more relapses and those sorts of. The stories are good so far, and that's really, really reassuring. So, thank you so much for your time today. Thanks, Andrea.
Okay. No problem. Thanks, everyone.
Thank you both.